Let's bring him in from Sports Medicine Center, Akron Children's Hospital, our very good friend, Dr. Joe Congini, with us this morning. Good morning, Joe. Where do you want to start this morning?
Hey, Ray, I want to start with a condition that is really flies so much under the radar screen. It's really underdiagnosed, undertreated, but it's very common in young athletes and teenage athletes. It does occur in adults, but it's very common between the ages of about 8 and 16, 20. Very, very common problem. And these athletes will have an injury, twisting injury, and they'll feel a pop, or they'll fall on the knee and they feel a pop. And, of course, the injury that gets all the publicity that everybody talks about is, oh, is it an ACL? Or some people even talk, could it be torn cartilage, a meniscus? That's usually an adult problem. But more common than both of those is a patellar subluxation or dislocation, a kneecap popping out of place. The groove the kneecap rides in is very shallow, so it's very easy with a twisting or falling injury to have that kneecap pop out of the groove and stretch the ligaments, or sometimes it swells a lot, tear the ligaments if it pops all the way out. And so these kids, though, very quickly, the swelling goes down. They start to do better. They start to feel better. First few days, it's swollen and they limp. But after a few days and a week, they're feeling better. So guess what young athletes would do? They go back out and play. And so they don't see anybody. They're feeling better. They go play right away within the first week or 2 weeks. And predictably, what happens next, Ray, is they would dislocate again and start getting to the point of where they get a loose kneecap or a floppy, we call it, floppy kneecap. And they can't push off and explode and jump as well anymore, and they have pain when they do those things, but they continue to wait with them. And many of them come in our office, and so maybe it's just frustration for me. I'm having a week where many of these kids come in 2 months later, 3 months later, and these are really harder to treat 2 or 3 months later because they're so stretched out, they're so loose. So it would be a plea for me to say it's a fairly simple early treatment. If people have a patellar kneecap dislocation early on, it's just a short period, maybe a matter of a couple of weeks of relative rest with a brace and with rehab to strengthen the muscles back up. And very often, almost always, no surgery needed on this. Kids go on their way, do really well, and have a great career and play well. But the ones who play right away and get to the point of where it's really loose, 3, 4, 5 months later, we really run out of options pretty quickly of what we can do with them, and they end up needing surgery in some cases, a fairly big surgery. We do have a better surgery than we had 10 years ago to fix it and tighten it back up. There's a couple surgeries that our orthopedists use, but this is one that's truly avoidable if people recognize it early on. But I truly believe part of the reason it's not recognized is because it's so flies under the radar screen. Nobody talks about it. It's not a sexy name diagnosis, a patellar dislocation. People just are not aware of this injury, and I wanted to bring out a little bit about this injury this morning.
All right, great stuff, Joe. I imagine you'll be front and center when you're talking about this Hoban boys basketball team Saturday night, huh?
Oh, yeah. When high school sports gets into things that occur that, not really expected and kids are doing some great things, it really, really can be a lot of fun. We talked about that last week, and a really fun ride. But these things are few and far between, and so schools go years, if ever, of getting to places like Final Fours or state championship games. Those are great. What a great weekend last weekend with the wrestlers having state championships, and the girls had some great tournament games. A couple of local schools right from here battled to the end. They've always been in it, like the Chippewa team in Doylestown. You got to say, oh my gosh, Coach Schrock, amazing with all the wins that he's had in championships. So high school sports is just really fun. We've talked about that before, and this is really a special ride, I think, for the Hoban boys team.
No doubt about it, Joe. Thank you for the visit. Always appreciate the time, my friend.
Okay, have a great week. Thanks, Ray.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us.